Okay, it's 12:31.
Thank you very much for that, Sharon. We will get started our webinar today, and just one moment here. Okay, well, welcome everyone to the Alberta Association of Gerontology Living Well, Enhancing Seniors Care and Services Speaker Series. Today's session is Supporting Wellness for Family Caregivers. I am Sophia Kelfen, a member of the AAG and your host today. And before we start, I'd like to go over a few housekeeping details. We are using Zoom webinar, so everyone is automatically muted and you will not be seen on camera. Today's session will be recorded, however, the names of participants and any personal information, however, will not appear on the recording or be shared. At the bottom of your screen, there is a Q&A button. You can use this to enter the questions. Please try not to use the chat box for the question, just the Q&A button. This will be for the speakers, and you can input your questions at any time during the session, though we will address them at the end of the presentation. So without further ado, I would like to introduce our speakers now. So first we have Dr. Jasneet Parmar, and she is the care of the elderly physician and the medical lead of home living and transitions in the Edmonton zone. She is also an associate professor, Department of Family Medicine at the University of Alberta. Her research currently is focused on supporting family caregivers of older adults by the healthcare system. With her today is Sharon Anderson, a research coordinator working with Dr. Parmar, and she is also a member at large on the Alberta Association of Gerontology Board of Directors. And so now over to our speakers.
So back in 2002, Roy Romanow, in his Future of Healthcare in Canada report, charged that healthcare systems and Canadians depended on family caregivers. Family caregivers provide about 90% of the work to Albertans living in the community, and they assist with 10 to 30%, or were assisting with 10 to 30% of the care and long-term care. And COVID-19 has demonstrated a need for our policy direction, our directional policy recommendation: primary care, community care, home care, supportive housing, supportive living, and long-term care policies should be revised to support family caregivers as well as older adults. And with that, so our objectives in this short time that we have together is to provide a background on Alberta family caregivers, why it's important to support family caregivers, and then how we should support them. So family caregivers are often referred to as a shadow workforce or an invisible workforce. 25% of Albertans are family caregivers, and they provide more than 388 million hours of care, 10 times more than paid healthcare providers. And Dr. Janet Fast from the University of Alberta valued their contributions at $5.8 billion. That was in 2012. Canadian family caregivers contribute $66.5 billion. So really important work. So family caregivers, we define them as any person who takes on a generally unpaid caregiving role and provides emotional, physical, or practical support in response to physical or mental illness, disabilities, or age-related needs. Now, the defining feature of family caregivers is diversity. Rural, remote, urban, suburban, caring for people of all ages and with very different conditions, as you can see on the bottom. And the trajectory is very different too. It can start with some sporadic care, help with a bit of shopping or some driving. But in something like cancer or stroke, it can begin with all kinds of personal care and medical care, as well as trying to manage income, work, finding health and community services. So family caregivers, as you know, provide a wide range of care activities, everything from financial management to helping with home and yard maintenance to managing crisis situations and advocacy. Now, you often hear a lot about family caregiver burden and the burden of care. However, anxiety and distress are much better measures to connect to well-being, as well as feeling lonely. So feeling lonely is linked to the risk of depression, dementia, and poor self-rated health. In fact, loneliness carries the same health risk as smoking 15 cigarettes a day, and it's twice as harmful to health as obesity and as lethal as alcoholism. Both loneliness and anxiety are rising with family caregivers, and particularly since the COVID pandemic. So in 2010, anxiety was about 16%. By 2016, about 33% of family caregivers of home care clients were anxious. And in our survey, and these are family caregivers of all types, 54% were anxious, and that was measured on a very reliable scale. The same thing with loneliness. Family caregivers are at high risk of loneliness. 35% in 2010, about 46% in 2016. And in our survey that we did in July of 2020, 85% of family caregivers were lonely. There's fewer family caregivers, smaller families, women are employed, changed family structures, divorces, children live far away. So there's fewer family caregivers. There's much longer care trajectories, longer lives, more chronic conditions, and medical advances make the care trajectory about 6.1 years on average. The other thing that's happening is people prefer to age in place. They prefer living in community homes, and there's actually fewer long-term beds in Canada. So that's why anxiety and loneliness are important to measure. But this is really important. Family caregiving per se doesn't cause burnout and distress. Just like any work, if you're being overwhelmed with work and worry, that's what's stressful. And the family caregivers at risk of distress are those that are providing 20 hours or more hours of care weekly, the ones that live with the caregiver because it's often more intensive care and personal care, caring for a person with complex care needs, and also providing medical treatments. So to illustrate just how much work Alberta family caregivers are doing, in 2019, this is a Health Quality Council of Alberta report, the family caregivers of home care clients were caring for an average of 115 hours a week. In July of 2020, when we did our report, this is 4 months going into the pandemic, so July of 2020, 36% of the family caregivers caring for someone in their own home added 40 or more hours a week. And for many, that was on top of already those 115 hours. So I'm turning this over now to Dr. Parmar, and she's going to continue.
Thank you, Sharon. What I'm going to share with you next is some of the work that we have done collectively with over 400 multi-faceted, multidisciplinary stakeholders from across Alberta, as well as some national and international colleagues. So going back to 2014, we started to look at an area that we recognized had been neglected. And that is, how are we supporting family caregivers from within the healthcare system? Initially, we met just to determine research priorities, but very quickly at the first symposium, we recognized that there is an emerging need to do something more effectively from within the healthcare system and move it into our clinical world. So research remains important, but operationally, we needed to start moving our healthcare system towards the direction of supporting family caregivers. And then it took us a couple of years to explore what are we doing in the healthcare system, how are we supporting family caregivers, who is supporting them, and what is the education we are providing to our healthcare providers to support family caregivers. And we came to recognize that we have a missed opportunity, and that within healthcare system, we really have not realized anything meaningful yet, other than what we have learned through osmosis and episodically in supporting family caregivers. And then we took on the task of saying, okay, if the biggest need is to educate the healthcare providers to support family caregivers, well, what does that education look like? And validated a competency-based education for healthcare providers, which we then use to co-design the foundational education, which we will share with you in a snippet, and have, as of last year fall, released it for testing, and earlier this month found our evaluation to show that it's actually quite successful. So now we are in the mode of disseminating this education across Alberta. So that was just a snippet of what we are trying to do from within the healthcare system. And there are other initiatives also under play, but we recognized during those symposia, and one caregiver actually stood up and said this to us, because there was so much sort of work happening on the caregiver front where we were trying to foster resilience in caregivers, educating them, giving them the responsibility, shifting care onto them, etc., not recognizing the stress and strain on them. The caregiver stood up and said, can you please stop trying to build a better caregiver? Can you please build a better system around us to support us? And for me, that was an aha moment. But what I also found was there's actually a great deal of intent and commitment to come together collectively as a system of care. So we have community organizations, we have policymakers, we have researchers, we have educators, we have local town councils, etc., all now coming together to collectively look at how do we support our patients, clients, or residents along with the family caregivers. And that is going to then give us that better system that we need, that wraps around that dyad of the care receiver and family caregiver. As far as the healthcare system is concerned, lots of little now attempts are being made, lots of initiatives are underway, but a big one is this caregiver-centered education of healthcare providers, which we believe all healthcare providers should receive. So we've called it foundational, and we put it online, and it's free of cost. And we would want within the next while for all healthcare providers to take it. And what it does is helps healthcare providers to provide person-centered care for family caregivers by doing what? Recognizing their role, communicating with them, partnering with them, helping assess their needs, navigating the systems of care, accessing resources. And we ourselves within the healthcare system also need to be good role models of caregiver-centered care, which we have termed enhancing the culture and context of care. This education has been planned with these over 400 multi-stakeholders, and at a major planning session in 2019, when we validated the core competencies for education, we were struck by a message that we received during the symposia that we have here for you, that we've had reports all the way back from Roy Romanov's report, but now we have to do something really innovative and try to make people understand in their soul that caregivers, family caregivers, call them carers, call them care partners, are vital somehow. And we took this message to heart as we developed the education to serve the core competencies. It's a population health approach. And as Sharon so nicely shared with us, the diversity in family caregivers, we want to make sure that whenever that diverse population interacts with the healthcare system, they feel supported. So this health workforce education is designed for healthcare providers to use their interactions to support family caregivers. And also, we are not to do this by ourselves. So we have placed ourselves in that larger system of support. So we consider ourselves as a part of the larger system, and that we work and coordinate with that larger system to support family caregivers.
Now we're going to give you a taste of communicating, of one of the domains, communicating with family caregivers.
When I was still a student nurse, soon to graduate, my need to understand family caregiving was urgent for reasons both professional and personal. We'd only recently learned that my mother had young onset dementia. It was a diagnosis that changed my life as much as it did hers. Luckily, I knew other healthcare providers like these: Dr. Davina Collins, case manager Cloris Mitty, and social worker Edward Mance. They had professional experience in working with caregivers, and at that point in my life, I soaked up every word they had to share.
What surprises me is the sheer volume of tasks necessary to take care of my mom. I'm training to be a nurse, and it amazes me how much there is to do. I don't know how to keep up with it all.
I felt that way too. My confidence in providing adequate care ebbed and flowed, but life found a way.
When I think about my career, it's astounding how much my attitude towards family caregivers has evolved. I used to avoid talking to them. I thought that by interacting with them, it got in the way of time with my client.
You're here.
Got in the way, but caregivers are the ones who do most of the work.
Well, you're just starting out in your career. We've been around long enough to have seen how caregivers have evolved. The perception of caregivers have evolved, and that evolution continues.
I don't think I understand.
Well, you see, when I first started out as a social worker, my primary focus was that to the person I came there to see, the care recipient.
Of course.
Yeah, I know. Well, at least I know now. I think my focus was a little too narrow.
At this point, what I'd like to do is share something, again, very innovative that we have embarked on. So we recognize that we have to support person-centered education and care for family caregivers. And we need to recognize that family caregivers are core health team members. And another recommendation that we've come to recognize and we need to absorb and assimilate is extending essential family caregiver infection control training. So these are immediate policy recommendations that have gone out, and we are trying to, in our initiatives of education, we are trying to support these policy recommendations. So both 1, 2, and 3 are now being absorbed into, are being offered within a training module that we are developing for healthcare providers to support family caregivers during COVID, the COVID pandemic, and 1 and 2 are already absorbed under the education for healthcare providers. But we do want to see the policies that affect our healthcare system to reflect these and those to be done relatively quickly. So I'll leave it now for Sophia to take over and invite questions.
Great, thank you very much. Yeah, thank you, Dr. Parmar and Sharon, for that very informative presentation of on the vast role caregivers play in our society and health system. We do have a couple of questions here in the Q&A box, and I'll read them out. The first question that has come up is, are there reliable financial supports to help caregivers to help recover their costs and time lost at work, especially related to long-term caregiving?
Sharon, did you want to take that, or would you like
I will actually. In fact, financial supports for family caregivers are one of the weakest areas of family care. As far as supports are concerned from federal government programs, only 6% of caregivers are able to take advantage of the various government programs that are offered to family caregivers. And that's the 2018 General Social Survey on Caregivers. So financial supports are a definite weakness. The other thing that we also know is that one of the reasons why people are admitted to long-term care and have the same needs as somebody that's still in the community is because there are many out-of-pocket costs for family caregivers. So lost work, lost pensions, just the out-of-pocket costs. So financial supports for caregivers is certainly a policy area that we need to work on.
Very good. We have a long ways to go still. Really grateful that you're getting this, spreading the awareness and advocating for compensation.
And Sophia, very quickly, I'll add to that. The other thing we're advocating for, again, these are policy recommendations. They have to happen at a high level, is paying family caregivers for providing care. So far we don't have that ability, and many family caregivers are giving up work to provide care, and it may actually be economically quite beneficial for the system and society at large if we paid family caregivers to provide care. So there is quite a bit of advocacy in that area that's happening as well.
Absolutely. Thank you so much. The next one is actually a comment here that says, a note of thanks to the presenters as it somehow moved me to tears. I'm a healthcare provider and also have a mother in DSL, too far away for me to be involved. Yet this touched me and I'm very appreciative of this work you are doing and very much support of it. Thank you. So that's a really nice comment. And I'm sure many of us echo that, the great work that you're leading. Another question is, could you please provide the link for the caregiver-centered care education? So if either one of you are able to put that in the chat box.
It's caregivercare.ca.
Okay.
Caregivercare.ca. I will put it in the chat box. And by the way, there's over 500, within the first 3 months, over 550 people have taken the education. And the reviews on it are just wonderful. The one comment that we've had is people have asked for closed captioning, and we've now added that.
Excellent, thank you.
Yes, and please, once you take the education, if you like it, please spread it. It's for the public good. Please, wherever you can disseminate that website and encourage healthcare providers to take that education, we'd be very grateful for that. And another, it's in the chat box, and I should have mentioned it. I'm the medical lead for home living. So we have created an invoicing option for family caregivers, so that, you know, they can actually, instead of having home care decide on who comes in and provides care, they can get that pocket of money and they can then take control of who comes in to provide care. And that's actually been very successful.
Thank you. We have a question that asks, the compassionate care program for the feds is available for 6 months. It is essentially EI. So basically a question.
And that's what Sharon was pointing to. There are actually both provincial and federal caregiver benefits. So and it's their compassionate care and critical care benefits. So it's basically an EI, and it gives you protection for your work, so you don't lose your job for that period of time. But it's vastly underutilized. So we again need to, and people interacting with family caregivers need to make them aware of these federal and provincial benefits.
Yes, absolutely. Thank you. There are some countries like the Netherlands that have provided funding to allow relatives, clients to receive financial support to deliver the care.
That's quite right. And there are other examples too. Actually, there's an example down east in Canada, Nova Scotia. There's an example in Germany. And yes, there are now precedents being set as in Canada, we've reached that point, and I can see interprovincially, there is now examining of this opportunity. We've been very nervous all this time, afraid of the societal cost if we start paying caregivers to provide care. And we are overcoming that fear now.
Excellent, thank you. The next question is about gender differences around caregiving. That there's seen lots of articles around women being mainly responsible and the resulting effects on women in the workplace, mental health, and the addition of household duties, just having to juggle everything.
Sharon, you want to take that?
Sure. Actually, men and women, the caregivers in Canada, it's now about half and half. However, what women tend to do is they tend to provide much more of the personal care, the care in home, whereas men tend to help with transportation or finances, you know, other things. So yes, and absolutely juggling your household duties and those sandwich generation caregivers where they're caring for children and parents at the same time it's the work and worry, the extraordinary care that people have to do that makes caregiving distressing. It's not caregiving per se.
And the gender landscape is changing. There are more and more men getting involved in providing care. So that's good news for women.
Yes, it absolutely is. Another question is, has the pandemic impacted the role of the caregiver?
Oh, absolutely. If you look on our website on caregivercare.ca, we've done a survey of the impacts of COVID-19 on Alberta family caregivers. And so it definitely makes a difference by where they were caring. So the family caregivers caring for somebody that lives with them had the biggest impact. Their hours of care increased significantly. It was hours increased for those that were caring for parents, for example, in another home. And then, of course, there was the family caregivers in congregate care that weren't able to care. And then as one or two designated caregivers, their care work definitely increased. But what we found is all of those caregivers were anxious and lonely. It increased for whether it didn't matter. And as we're doing interviews with family caregivers right now that completed the survey, it's really clear that we really do need to support family caregivers, that they do feel like they've been left alone and their work really hasn't been noticed.
The pandemic has taken a tremendous toll on family caregivers. So I'm going to say to everybody attending today, if you know a family caregiver, please do reach out to them and provide your support.
Very good advice, and thank you for that information. We are at the end of our session, and I know I didn't get to all the questions, but I do want to thank our presenters again, as well as the participants who were able to join us today. As mentioned, the webinar will be recorded and will be made available, and we hope to see you again next week on Thursday, February 25th, for our next session in the series, Living Well at End of Life. Thanks, everyone.
Sophia.